let me first talk about this alpha antitrypsin. You already know alpha antitrypsin. This is a liver cell. So in liver cell, what will happen? Alpha antitrypsin is synthesized normally and secreted, and from liver it will reach lungs. It will reach lungs. From liver it will reach lungs, and in lungs it will be effective. So what will happen in abnormal condition where a simple one amino acid mutation will cause polymerization of this elastin, and because of that polymerization, elastin will not be secreted, it will be rather degraded, or it will accumulate in hepatocyte. So as a result, what will happen? Hepatocellular damage will happen. Hepatocellular damage will happen, and at the same time, because this elastin, this alpha-1 antitrypsin, ATT, I will call it alpha-1 AAT. So AAT is not available to lungs also. So what will happen? This lungs will also have pathology. So we will talk about how this AAT helps lung. So what will happen? The pathology of deficiency of alpha-1 antitrypsin will affect this liver plus lungs. Liver plus lungs, LL. It will affect liver plus lungs. So let me talk about how does this alpha-1 antitrypsin help. So alpha-1 antitrypsin, what happens? I will tell you here. So in lungs, so alpha-1 antitrypsin comes at lungs, and in lungs you have elastase. So lungs macrophages. So macrophages inside lungs alveoli. Macrophages in the lungs alveoli release elastase. Elastase is an enzyme that will have to be blocked by alpha-1 antitrypsin. Alpha-1 antitrypsin, when it binds to elastin, it will result in a ineffective elastin. It will neutralize the elastase, ineffective elastase. So why elastase is released? Because macrophage actually is a defense mechanism. Your lungs is exposed to external environment. So bacteria is always coming, and that is why macrophage has to be active there. And in that and due process of defense, macrophage release elastase, and this elastase will cause damage to the lungs tissue also if it is not present. So what will happen if alpha-1 antitrypsin is absent? So this elastase will cause lungs damage. This will destroy elastin. What happens? This elastase destroys elastin, and because of that, lung damage will happen. So this is alpha-1 antitrypsin is a very important disorder where you will find pan-acinar emphysema of lungs, and then cirrhosis of liver. Both things will be, and this is worsened by smoking, because smoking also will have extra damaging effect on your lungs. That is why smoking will worsen this condition. So remember, lungs will have pan emphysema. Which type of emphysema? Pan-acinar emphysema, and liver have cirrhosis. So this is two cardinal feature of alpha-1 antitrypsin deficiency. This is a very important concept. Two types of, and you can see alpha-1 antitrypsin in electrophoresis also. In electrophoresis, if you do electrophoresis, there is a band, alpha-1 band. You will see alpha-1 band, they're missing alpha-1 band. So you can find from electrophoresis also, you can diagnose this alpha-1 antitrypsin from electrophoresis. So these are the important concepts. As we have studied all the protein like deficiency, defect in collagen and other elastin, this is also dominant, but this is called codominance inheritance. Okay, codominance inheritance. So what means codominance? If both gene are mutated, then the disease will be very severe. If only one gene is defective, then there will be moderate kind of disease. So this is called codominance. So this is class of protease inhibitor. It inhibits elastase. So remember, this is a very important concept, synthesized in liver. Now you can see this is pan-acinar emphysema. So all emphysema will be affected. Both sides symmetrical. The alveoli will be affected symmetrically.